Hello, everyone. This is Robin Lanzi with the UAB CFAR Behavioral and Community Sciences Core. Eddie Jackson, who is our Community Engagement Program Manager, and I are thrilled to welcome you to the Inter-CFAR Faith and Spirituality Research Collaborative Summer Webinar Series. And on behalf of the Inter-CFAR Faith and Spirituality Research Collaborative, we would like to welcome you to our first of the summer webinar series. We, as you may know, originally planned to have our Inter-CFAR Faith and Spirituality Research Collaborative meeting in Birmingham, Alabama today, May 19th, for a full day of plenary speakers, panel members from the faith community and community-based organizations, people living with and or affected by HIV, researchers, clinicians, and state and federal partners here, ending with a reception hosted by Southern AIDS Coalition. But as we know, with COVID-19, we are all looking at new and innovative ways that we can still stay connected, and we are committed. We are committed to continuing our so very important collaborative work, and we are extremely thankful to the Legacy Project for hosting this webinar series and allowing us to be able to continue our work and look to ways that we can support each other and learn from each other. And so what we are doing is offering a summer webinar series on the third Tuesday of the month at noon Eastern, and this is the first of the series. And today's title is Faith Over Fear, How Lessons from HIV Are Informing Our COVID-19 Response. Next slide, please. And so just to first orient you to how we will have our agenda today, I'm going to give the introduction and do a little bit of housekeeping, and then we will have an opening prayer by Reverend Duncan Teague, and then we'll have our panel discussion of our esteemed panelists and our moderator, Aquarius Gilmer, for about 35 minutes, which will be followed by a general Q&A discussion and for about 15 minutes, and then we'll have some closing remarks. I encourage you to put any questions that you have into the chat box, and we will be monitoring that. Throughout the seminar, we will be, participants will be muted, and we will not have our webcam on due to bandwidth, but we will be monitoring this, and all of this will be recorded. So please know that this information in the seminar will be recorded, and we will upload it to the CFAR site. We have, and we'll have a final slide that shows you where that is, along with all of the legacy channels, including their Facebook. And so we will first begin with our opening prayer by Reverend Teague. Reverend
Good
Teague.
Morning. I am honored to be here. I am the founding minister of a small Unitarian Universalist congregation in Atlanta's Southwest community, the West End community of Atlanta. And this morning, as I was getting ready and I checked my social media, a friend sent me a link to a Stevie Wonder song that sent me to another song that I just want to keep in mind this morning as we go into prayer, because in most of our spiritual traditions, prayer is either preceded or followed by a song. So given that Stevie Wonder wrote a whole lot of sacred songs for us in many ways, and his birthday was just last week, I want you to keep in mind his song, Love's in Need of Love Today. And at another point in the song, he says, send yours in right away. And if there was ever a time when we needed all of us to send our love in, it's right now. So as I go into prayer, however you center yourself, however you approach the holy or the sacred, or just have a moment in a quiet place where you want to hear from yourself, if you'll go there with me now. Dearest gracious Spirit, we are humbled to have the ability to gather across hundreds of miles to be together at such a time as this, when we need each other more than we ever have, when we need each other in ways that we did not imagine before. We begin our work today as educators, students, researchers, spiritual leaders, and plain old concerned people by saying thank you for this moment in our lives. We are so grateful for our health, as well as it is in this moment. Thank you. May today be a day when we put love back on our agenda. May we use our precious gifts of time and talent and abilities to understand some things as offerings to our fellow humanity. We bless this event today to heal someone from the anxiety and the fear of COVID-19 and from anything else causing distress. We offer our hands to hold those who are grieving losses or near losses to this virus and the other causes of grief and loss in our many lives. May we lighten somebody's burden by what is done and said here today. May some hope rise from hearts that have not felt like hope in a long time. May our collective will be to bring healing in any form we can provide it this morning. I close this prayer by asking that we remember all those who have been sent to show us and to bring us over and over again to salvation, to liberation, and to bring us into better lives. And we ask the sacred to forgive us for what we continually have done to those messengers. It is in their many sacred and precious names that we ask that our work not be in vain today. So may it be. Amen. Amen.
Amen. Amen. Thank you, Reverend Teague. That was beautiful, and I think a wonderful way to start our time together, and very thankful for you, thankful for all of our panel members. And as a way of introduction, our purpose for today is to bring together faith and spiritual communities, CFAR investigators, and federal and state and local agencies, organizations to foster dialogue and build research capacity in prevention and treatment and care of those living with and affected by HIV. Our webinar series mission is to support HIV science in the realm of faith and spirituality and highlight best practices for faith community responses to HIV with a particular focus on the Southeast in the United States. We hope to advance the scientific agenda, learn from scientific work, and build on the lessons learned and best practices as we build new collaboration and develop new and innovative ideas for HIV, faith, and spirituality research. Today's panel looks at the way that the knowledge and experiences of those individuals and communities most affected by HIV serve as the essential foundation for a scientifically sound, community-focused, and sustainable HIV response. At times, many medical and public health researchers have assumed a kind of expert knowledge that supersedes community wisdom and efforts to establish and nurture strong community partnerships are relegated to the function of an advisory board. We have learned hard lessons to ensure that sound HIV prevention, treatment, and support initiatives are informed by the priorities and insights of communities most affected. For faith-based initiatives, however, this issue remains quite complex. Often, religious leaders are identified as experts who talk about the lives of women, gay men, trans folk, and people of color, the communities disproportionately impacted by HIV in the southeastern United States. However, women, gay men, trans folk, and people of color themselves are rarely asked to lead faith-based HIV initiatives, but are relegated to an advisory role, if invited to participate at all. This panel will discuss how members of the communities most affected by HIV can assume leadership in faith-based HIV initiatives carried out by HIV researchers, and how the religious and spiritual practices of these communities can inform such initiatives. Drawing on the idea that the knowledge and experiences of those most affected by an event should inform a public health response. The panel will also discuss how community knowledge is essential for sound response to COVID-19, both in the United States and globally. We are thrilled to have our esteemed panel members and moderator. Reverend Duncan Teague is the Senior Minister of Abundant Love Unitarian Universalist Congregation in Atlanta. Since 1984, he has responded to HIV in Atlanta and across the U.S. as a caregiver, artist, activist, and educator. Through those efforts, Duncan emerged as a community leader on HIV, both for Black gay men and for other communities infected and affected. A decade ago, he returned to seminary as the first step to pursue vocational ministry. Upon graduating, he helped found Abundant Love as a spiritual home to anyone in Atlanta. The pastoral, preaching, and community ministries of Abundant Love reflect the same commitments to social justice and health for all that have marked Duncan's community work around HIV. Rabbi Josh Lesser leads congregation Bet Havering, a reconstructionist Jewish community in Atlanta, Georgia. Since 1985, they have welcomed not only Atlanta's LGBTQ Jewish community, but also anyone with spiritual questions and interests. In addition to his leadership, Josh has been a powerful public advocate for those living with HIV for decades. This advocacy reflects his leadership in social and economic justice movement, both in his hometown of Atlanta and as a board member of various Jewish and interfaith organizations nationally and internationally. Reverend Jenner Sanders is the pastor of Beloved Community Church, the United Church of Christ congregation, a diverse progressive faith community in Birmingham, Alabama. She works at the intersection of public theology, social justice advocacy, creative expression, pastoral care, and a conversation to explore how we find and express the sacred in everyday life. She daily engages with Birmingham's mix of people, politics, and power, seeking to be both a keen observer of and active force in efforts to make the city and the world a better place. John Blevins is an associate research professor in the Rollins School of Public Health at Emory University, where he directs the Interfaith Health Program, an applied research program that is examining religion's varied effects on health beliefs and behaviors and religion's influence on health policies. Upon graduating from seminary in 1992, John's first job was serving as a chaplain in Chicago to adults and children living with HIV. He has worked in HIV programs across the Southeast since 1995, beginning in 2010. John's work in HIV and religion expanded to global context as part of various interreligious initiatives sponsored by U.S. President's Emergency Plan for AIDS Relief, PEPFAR, and the Joint United Nations Program on HIV/AIDS. Our moderator, Aquarius Gilmer, is the Director of Government Affairs and Advocacy at the Southern AIDS Coalition. He is also an ordained reverend and graduate of the Candler School of Theology at Emory University. His work focuses on spirituality, health, science, and democracy. Thank you all for joining us, and I turn it over to our moderator, Aquarius Gilmer.
Robin, thank you so much, and thank you for the CFAR, Inter-CFAR Network, as well as the Legacy Project, and all of you who have taken the time today to join us on this webinar. I'm going to dive right in, and I also will say that as we were planning this webinar, this series, that it is not lost on us around the ecumenicity and plurality of religious and faith practices and traditions. And so if you do not see yours represented on this webinar today, please stay with us. We will ensure that we'll join our best to make this as ecumenical and as inclusive as possible. So with that said, I want to ask our panelists to respond to this question in 3 minutes or less. And the question is, describe from your experience any parallels between the COVID-19 and HIV. Or another way is, how does this pandemic mirror the early HIV/AIDS response? And what lessons should we be implementing or utilizing to ensure that we don't make the same mistakes again?
If we're being shy, I'll go ahead.
Sure, Duncan, please.
What I found interesting about the parallels is from the earliest days of the epidemic, the federal response was slow, hesitant, and so based in bias and fear. There are some differences in how that bias played out. This time, instead of despising gay men, we've decided to make China the enemy. Rather than working on what will be best for everybody. And I also want to say that in keeping with my comments earlier, and I'm sure that Stevie Wonder is to blame for this, I am sorely seeing a lack of love as the center of the public health policy from the federal level. And replacing love with a desire to see profits return to cash registers. And that's a problem for me.
I can go next. Thanks everybody, and thank you, Duncan. I would echo what Aquarius just said, what Duncan just said, in regard to the messages from the in some aspects of our federal government, particularly coming from the administration. I do think that we live in a context where many things are being politicized in our cultural moment, and in response to the COVID outbreak, science and evidence are being politicized in a way that is putting the lives of so many people at risk. I also see a parallel to what we saw with HIV, in that this is a global epidemic that takes on different characters and characteristics based on context and geography. One of the things that I'm hopeful about, and I hope we can build on, is that the networks of capacity building and trust that were established in the HIV response have been important resources in pandemic response globally. That was definitely true in regard to the 2014-2016 Ebola outbreak, particularly in West Africa, and we're now seeing it in the global context in regard to COVID. I think there's a lot of lessons to learn from that for those of us who are in the U.S. In regard to a COVID response, and that the capacity we built through engaging communities and community leaders and key stakeholders through HIV is really important for a strong COVID response. In the specific issue of religious leaders and FBOs that have been built through the HIV response, they have been key also in the global COVID response. And I wonder if we could do the same with our response here in the United States. I do have a couple of questions in regard to what lessons should we be implementing and utilizing to ensure we don't make the same mistakes. And these are questions in front of us right now, it seems to me. I would say that one question is that can we ensure that the religious communities and leaders who reflect a sound public health response to COVID are heard? Will they be heard? And how will they be balanced with other religious voices we're hearing? I think this is important because of the role that religious gatherings have played in spreading COVID. On the flip side of that, the public health response needs to be respectful of religious practice, especially as we're now moving from an approach of quarantining to an approach of risk assessment and moving back into some kind of public context more readily, whether we're ready for that or not. That's starting to happen. And how can we modify religious practice and gatherings and find common ground between these practices and a sound public health response? And how can we figure that out respectfully? And then finally, how do we assure that the voices from the communities that are most effective are heard? As we have seen throughout our modern history in this country, this outbreak is disproportionately impacting those who are poor, those who are communities and people of color, and how do we ensure that the leadership and voices from these communities are at the table in determining a response to this outbreak? That requires us to analyze power structures and to think about the political and structural systems that decide whose voice gets to be heard and whose voice is overlooked. Thanks.
So I will follow along in the lines of the things that were just, this is Jennifer Sanders from Beloved Community Church in Birmingham. And I think my thoughts both reflect and sort of reframe some of what's just been said, in that I think we see two particular things that are of interest to me right now. One is that in this polarized environment that we're in, as in with early HIV, we see contested and competing claims for the moral high ground. So kind of on both sides of this, people are claiming the moral high ground. Right now we're finding, we have the folks who say that they are speaking for freedom and liberty. And then we have people who are talking about public health and compassion and concern for one another. And it just as in, in the early HIV epidemic, you had polarization around people who were claiming the moral ground around what they saw as morality and then what they saw as compassion. So but there's a power differential there. And I think in this, power differentials are always key to remember. And they are in situations where although one side is claiming to be the victim, even though it actually has more cultural, social power and is exercising that in ways that harms others. So I see that as one thread. And I think it connects to the second real thread I see, which is a sort of the capitalist alienation that we're in. So where we have sort of this juxtaposition of an ethic of justice and compassion versus an ethic of profit and control that's consistent with modern oligarchical neoliberal capitalism, which is something certainly on the rise in the early 80s and that we see now and how it is as a prevalent force. And somehow within this, our faith traditions and science and ethics and our sense of care all hopefully give us some type of way to destabilize and deconstruct these binaries in such a way that we find a way forward. But I think that the ways in which we have this difference of view in the world is something that we'll have to find a way through.
Absolutely. Thank you all. I just want to
I'm going to jump in and introduce. Can I respond, Aquarius? It's Josh.
Sure. Go ahead, Josh.
Sorry. So I want to add, probably start backwards and say that in order to kind of respond in this moment around, how can we avoid the mistakes? Since I think we've heard some excellent things laid out. I really feel from a faith perspective that we're looking at this moment as both a prophetic moment and a pastoral moment. And I think that the faith communities need to be involved in bringing the fullness of both of those responses. I'm very aware that in both in the time of early AIDS and in this pandemic, that there are groups of people as we've heard, who are expendable, who are seen as not worthy, or who are left in the margins. And again, I think that there is both a prophetic and pastoral response in those communities. And in many ways, it was a much more marginalized faith community that was providing the pastoral support during early AIDS, and I think that we need to bolster that pastoral support for those communities so that not only are they engaged in a sense of healing and wholeness that is needed, but that also to be able to move folks to a place of feeling empowered to share their voices and centering those voices. I think that we've also heard that both the AIDS epidemic and this pandemic exist within a larger system that is broken. As someone who is a part of ACT UP, the AIDS Coalition to Unleash Power, I really saw how a justice response was suppressed. And in many ways, because of some of in a different way, but it feels similarly, it's because of some of the way that this pandemic allows or doesn't allow for mobility. There's been an easier way to suppress some of these voices, and I think that we need to continue to be creative, just as folks like ACT UP were, to be able to bring that justice voice. I think a lot of what gets broken down in the conversation relates to how we move through this time with shame and stigma all the way around, and that the faith voice to be able to help us move beyond that sense of stigma or shame feels incredibly important. My experience from the AIDS epidemic was that we found love in the margins, and that we created communities when there wasn't community that was concerned for those who were affected and infected by AIDS and HIV. And I think that we need to continue to build those kinds of communities. So I'll just conclude by saying that there needs to be an integration that was sorely missing, and that I think that the faith voice is often a voice that holds up integration as one of the highest values of approaching problems, and that ironically, without our voice, it denotes a lack of that integration.
Oh, that was wonderful. Thank you. And my apologies, Josh, for interrupting you there. And the pastoral piece, I just want to bring in a comment that was made in our chat box by Daniel Harris, who's made note that, with religious communities now using technology as a means to connect with their parishioners, this is also an opportunity for those same communities to actually think about the sort of data collection that speaks to, Josh, your point around the pastoral moment, to really map out the needs of people. So that's a great recommendation. I want to move us to the second series of questions, and panelists, please feel free. Yes?
Could I just say something really quick on that? And it's also
Sure.
a plug for something Joshua has done. Josh created a Facebook group with now a little over 7,000 members. Josh, correct me if that's incorrect. That really is functioning in that way. It is a place for religious, and it's a Facebook group for religious leaders to respond to COVID, to support religious leaders as they respond to COVID. It's a place for religious leaders to share ideas and innovations among themselves. It's also a place for them to offer support to one another and to speak about ways to care for their congregations, their communities, and to advocate for social justice vision in relation to this outbreak. And it's really quite a robust and powerful kind of example of that kind of innovation that Daniel was speaking about. So I just wanted to highlight that.
Yeah, since we're on that, John or Josh, would you just give us the name of that group so folks can have that?
I put it in the chat. It is
Thank you.
Spiritual and Communal Responses to COVID-19.
Thank you, Josh. That was really great. So the second set of questions, I guess, anyone please feel free to respond to these questions, and then we have about 3 that we'll try to get through. And the first is, can you describe for us the complexities of faith in the lives of Southern LGBTQ plus people? How has faith been weaponized, and how is it also a source of healing?
Aquarius, how much time do we have?
Yeah, so probably maybe a minute or less.
Who's willing to bite that one in a minute or less?
I'll jump in. This is Jennifer, and I'll just jump in and say that what I often say is as queer clergy, I've never had a death threat from an atheist, and so I think that and yet faith is
Amen.
what gives life. Faith is what gives life to my calling and my expression in the world, and I think that's true for many of us. And so that tension is right where we live, I think.
I want to say that Jennifer, you had more?
It
no,
was
I'm
Josh.
good.
Go ahead, Duncan.
What I was going to say was I remembered, and I'm living in the complexity of the place that tells us who we are, where we come from, what we value, meaning our faith communities, and especially for African Americans. And that same space, if we use the word weaponized, taking misinterpreted scripture, yes, I said it, and using it to harm, hurt, and create communities of harm and hurt for the queer African American folks needing those same spaces. But because the AIDS epidemic is not a few months old, and it is now going into decades and decades, and I was young and pretty when this started, and I think I'm still pretty, but I'm not young. That epidemic has fomented and forged communities of faith that, in fact, are the opposite of what I described. So today, there is a Bet Havering for those who need an affirming Jewish space and a space where the heterosexuals are not there to get high on homophobia. And there are numerous African American congregations that don't just tolerate queer folks, they affirm them and ordain them and support them. And then there's the whole liberal religious traditions that have been doing this for a long time, like the Unitarian Universalists. So there's more available, and we've got to figure out now what space are we going to create spiritually for a child who is COVID positive, and what is that going to mean?
I just want to put a finer point on it, which is that as someone who isn't Christian, that to be a person of faith in the South typically means, I would say stereotypically, to be hegemonically Christian and white. And so I think that there is a Southern culture that needs to be reinvested and basically divested from white supremacy and Christian hegemony. Because what you end up finding when you know a different South is really the loving, community-centered, hospitality-creating roots that deeply value community and knowing and loving your neighbor. And so if we can break down and challenge the hegemony and challenge the white supremacy that has been part of the illusion or the myth of Southern religion that is all too often damaging, that is what I think is needed at this moment. And really what's at stake is, Duncan was saying about this child or even beyond that is that to me, having grown up in the South, rituals and traditions are incredibly important. And so when they're denied to you, so when you can't grieve a loved one openly, it creates additional trauma. And so the best of Southern religion and spirituality can actually heal the trauma. Our sense of really knowing what it's like to have our lives interwoven together, this idea of beloved community that can be uplifted, that is the salve for the trauma that an older form of Southern religion has caused and created.
And this is John. The only thing I would add to what Josh and Duncan were both saying is, one is that some of these communities that I am grateful exist in our region may be harder to find in rural geographic areas, and I just think we need to acknowledge that the spiritual landscape of a Birmingham or an Atlanta is not the spiritual landscape of a Jessup, Georgia, or Phoenix City, Alabama. And the other thing I would say is that it's been 30 years since HIV first hit, and that we now have more faith communities representing the mainstream of religious traditions coming forward to be more welcoming places for LGBTQ folk. And there are some LGBTQ folk who have said, well, you're a couple of decades too late and you're welcome in hospitality. We've already created our own spiritual communities and places and practices and networks. And similarly, there are now some congregations and traditions coming out of historically white Christian contexts that are saying to African American sisters and brothers, we want to be part of a movement with you for racial reconciliation. And we sometimes are told, well, that's a couple of hundred years too late in your efforts, because we've been doing this work for a long time. And I think part of what's needed in that is some compassion with one another to find common humanity, but also some humility for those of us who try to make those bridges, to do so in a way that we look for the places where that's already being practiced and it's already part of the fabric of communities that we want to relate to better, rather than assuming we have all the answers and we figured it out. And sometimes that's hard to do.
Most definitely. And I often think about, John, in this moment, the United Methodist Church, right, which is on the brink of splitting into two different sort of churches because of the question of the affirmation of the full personhood of LGBTQ persons, but also accompanying humility is some level of a great amount of accountability that's needed to move the conversation and to move the beloved community into action. And there's a question that Daniel has a lot of great questions, and he wants to know from the panelists about trauma-informed congregations and churches, and even trauma-informed practices for both Christians, Jewish folks, Muslims. What sort of trainings, tools, bodies of work that exist that help congregations address trauma, or people address trauma, excuse me?
I'll just say that within our movement, the Unitarian Universalists, this is Duncan, we in fact have a trauma response team because in the late 20th and 21st centuries, churches have become places of horrendous violence by folks who wanted to make statements by committing murder within the walls of our sanctuaries. And the Unitarian Universalists have not been left out of that. So we, in fact, had to develop, not just for health concerns, but for actual people's trauma of witnessing the lives of your fellow parishioners taken in the service. It's interesting with your question to see if we can then modify that response, that ministry, to now be far more broad sweeping, because we in fact are all experiencing trauma, not from the butt of a gun, but from this epidemic or this pandemic.
I would say that I love this question because the first actually group gathering that we're doing from my Facebook page, this is Rabbi Joshua Letzer, is a webinar on the introduction to trauma-informed care for spiritual leaders and clergy, specifically because of the trauma that this pandemic is triggering and creating. And I think that for me, what has been really important about this kind of shift is that it upholds a sense of curiosity and humility. Rather, when I said break down the sense of shame and stigma, that's often the response that happens when we are not trauma-informed. But if we can begin to create spaciousness, to emphasize things like communal and self-care, and begin to examine why we respond and react the way that we do, we create a different kind of opening. And so when so many faith communities, and I think sometimes particularly in the South, when there is kind of like, we have to have all the answers, God is the source of answers, or the pastor as an emissary of God has, rather than we are a container for the important questions in life, we can explore and journey together as we walk towards healing. That to me is a really profound kind of shift that also shifts the power from a few people to the entire community.
That's one. Go ahead, Duncan.
No, I just wanted to add that, Josh, if in fact we're able to do what you propose, it is also not going to be a 2-year ministry project. But in fact, some part of our ministries now are going to have to cope with this trauma as it has become in the life of faith communities from henceforth.
Yeah, and I think
that is why, Duncan. Oh, go ahead, Jennifer.
No, go ahead. Finish your thought, and then I'll finish your thought, and I'll come in behind you.
Sure, and that is why, Duncan, that I think LGBT-founded communities can often be leaders, because we have been doing this kind of trauma-informed work for decades. We know that this isn't a 2-year fix, but we know that it is a way, it's an entire shift on how you be in community together.
Yeah, I think that's kind of where I was thinking that it's a way to live. It's the way that we live and the way that we practice our faith. And Beloved was founded as an intentionally interracial congregation in 2000, and we have, we find in our community we have a little bit of everybody. We are black and white and young and old and rich and poor and gay and straight and cis and transgender, people from all kinds of economic backgrounds and theological backgrounds. And one of the things that we encounter within community, and I see this played out in lots of other spaces that I'm in, is that oppressed people oppress other oppressed people. And so a part of this is our awareness, our self-knowledge of our own trauma and the ways in which we are subjected to power that oppresses us. And at the same time, for most of us, the ways in which we're also often on the upside of the power balance, so that we are both power down in some ways and power up in other ways, and that we move around that axis all the time. And in the ways in which we wield that power, we may be causing harm to other people and inflicting trauma. So that awareness of the way in which we are in this sort of shifting and fluid pattern with each other and with ourselves is a way of understanding. Somebody just wrote in the comments about a cultural shift. It is a way of being in the world, not just sort of, it's not a training you do in an afternoon, and it's not, it's not kind of it's an orientation and posture in the world, I think.
Oh, most definitely. It is what I guess Dr. King would call or consider the maladjusted, being maladjusted, right? Forever in a position that we're really seeking to dismantle power in a way that it's over and against, but to think about the ways that the beloved community is described as how power is given to the least among us, right? And then the lion's share is there so that we can enter as little children in these communities and function as full humans. I know we're about 15 minutes to the end of our time together. I just want to give one more question to our panelists. It's been really rich. And that is, and Rabbi Josh and others have hit on this, a bit earlier. Even the trauma-informed care question hits on this, but the question is, how can faith and science better work together to create tools, intervention, and the messaging needed for this moment and beyond? And what should our partners like the NIH be considering for research both now and for the future?
I have a big mouth, so I'm just going to go on ahead and respond. This is Duncan again. I am curious about what it would have meant for the faith community to have responded nationally on behalf of Dr. Fauci. For the broad-based faith community to have said, on behalf of the American people, we want to hear from the experts in a way that is respectful and honoring of what they are attempting to do at this moment in history. And yes, in certain ballparks that may have fell on deaf ears, but I think it would have maybe changed some of the rhetoric and some of the tones to know that there was some group of people out there representing a moral and ethical, a loving-based care of the American people and their health to say, no, you cannot treat our experts like that. No, you cannot racially profile a national journalist while we're trying to get answers about coping with a pandemic. Some part of our job as faith leaders feels like that's part of what we have to do.
This is John. Duncan, that makes a lot of sense to me, but I would also say that I've seen a lot of religious leaders trying to do that, both in individual ways and in collective ways, and sometimes I find it really hard to cut through the noise of the ways in which all of this is predetermined by the mechanisms we have in place now to talk about these kinds of issues. That's not to say we shouldn't do it. It's also to say that I think there have been religious leaders who tried to do exactly that. As someone who's trained in theological studies and comes out of a first job and what I thought was a calling to vocational ministry, and now finds myself working in a school of public health. On the flip side, I think the finding the common ground for religion as a social force expressed through faith as well as public health, that those of us who work on the health side and the public health and clinical side of that equation, we need to be more respectful and to build relationships with our colleagues who are religious leaders, and to do that in a way that's not instrumentalist. And what I mean by that is, 20 years ago, people in public health wouldn't have paid much attention to religion. They would have seen it as something that if a person wants to do that in their personal life as an action outside of work, go ahead and do it. I don't understand why anyone would do that, but go ahead and do it. There was an anti-religious bias that was often part of the field of public health in my experience with it. Some of that still remains, although I think we're coming to the place where we understand that a collaboration and a partnership is important. The thing that I think this outbreak is demonstrating to us is that we have to build true, genuine partnerships together, and we can't do that only by thinking about what's in it for me in my field. And one of the things that I think public health often does is to build partnerships with an eye toward furthering the goals and objectives of the public health project or the research program, rather than building relationships to demonstrate mutuality. That's a hard thing to do in a funding environment and in a research environment, that is seeking outputs and outcomes that make a difference. But it's also really important for sustainability. And we're not going to build that optimally in the midst of an outbreak, but I think one of the things that this outbreak is showing us is that we've got to build it, and to do so in a way that truly is mutually respectful.
And, I would – go ahead, Jennifer. You got it.
Yeah, I think we'll toss it back and forth. Yeah, I think that's really true in the sense that all awareness of the interests at play in any given institution are useful because we cloak a lot of this in the rhetoric of trying to do greater good, and that greater good is really there, but there are often university self-interests and institutional self-interest and church self-interest and all these things involved. And if we don't pay attention and sort of name that in the way that it works, then we can end up using each other in ways that are antithetical to our mission in this. And I think that that's one of the challenges, and especially also realizing that every faith community, and indeed every community, including the scientific community, are all communities of interpretation. And the ways in which we either lift that up and grapple with that in goodness and with goodness, or else that we claim that we have the monopoly on the truth, which is, that's a form of fundamentalism, and fundamentalism comes in many different forms. You can have fundamentalist atheists and fundamentalist scientists and all that. And so the ways in which we're willing to sort of step into discomfort and in order to find that mutuality in a respectful kind of way, always being aware, again, of kind of power differences. But it is, I think, calling for the moment to do this work with real integrity and ethic and honoring the spirit that we bring to this.
And I'll just say, using the kind of model of the prophetic and the pastoral, that I think that there is mutual interest for scientists and spiritual leaders to uplift prevention and well-being for our communities. And so for us to be able to partner and use our prophetic voice, or even as, Ronit Elk mentioned, that, part of being able to do palliative care has been able to rely on the trusted voices within the community, that there are ways where, to be able to be part of a system feels very important, and how we can serve each other's interests for that larger common interest is really important. And then when I pivot to the pastoral in a completely different way, I think there needs to be initiatives now thinking about the moral injury and going back to a trauma-informed worldview, that many physicians and scientists are put in places where they are exposing themselves to grave moral injury. And I hope that we as faith leaders can support that pastoral need because we need their effectiveness, but we also have to recognize that we are all human and that there is humanity that is a part of this, that as important as the science and data is, we can't ever divorce our humanity from the work that we're doing. And I think that's a very different but important way that we can partner together.
Well, thank you. Robin, at this time, I know that we're about 5 minutes before the end of our webinar. Are there any other questions from our chat that we haven't been able to eliminate? I know that our panelists have been rock stars and hitting on most of these that I've seen, but are there any other questions, Robin, that you see that we need to dive deeper into?
Sure. There is a question from Alex about research and collaboration between science and spiritual leaders, and interests and examples on how this can be done on a systemic level.
That's a great question. This is John. I'll speak as someone who works in a school of public health. I think it is hard to build and important to build, and you won't build it completely overnight. So I think the things that we do pretty well at Emory around religion and public health. We have both our program, the Interfaith Health Program, and a university-wide interdisciplinary research program in religion and public health. That reflects about 25 years of effort to have built that kind of work that can draw people who are epidemiologists or statisticians or anthropologists or theologians to the table to examine that kind of work. And so I would encourage folks who are looking to build a research platform and to build scholarship in this way, to start with whatever your resources and capacities that are most immediately at hand and work to build out from there. That may be a qualitative study. Duncan and I are involved in a qualitative study funded out of the Health Sciences Center at Emory that's seeking to understand the spiritual lives of Black gay men in Atlanta to inform faith-based HIV prevention and support initiatives in Atlanta. It may be qualitative in nature. It might be working with epidemiologists or clinical practitioners who would approach this from a mixed method or a quantitative standpoint. But start with what you've got and work to recognize what you've got, the gaps in it, and try to fill in those gaps. But don't try and build something completely from scratch overnight. It will take time.
I want to jump in with a thought, too, just kind of behind that, which is also if you are coming into a space, as somebody who's involved in a lot of different parts of community stuff, so often we have people who are coming from university or scientific settings or something who are like, oh, look, either here's this thing we want to do for you, or here's this thing we can do for you. And they come with a preformed thought and agenda. And so they're trying to figure out how can we in the community fit into their agenda, whether it's learning or providing. And so often what I always recommend to students at any level and to researchers and academics is show up first humbly, seeking to learn and to know the setting. So if you're living in a community, get to know the community, show up for community events, invest some time and energy, and some of your own time and energy just showing up and being a person of goodwill and developing relationships with people. And then really meaningful things can come out of that. But a lot of people in the community, especially if they're communities that have seen people showing up over and over again, are tired of feeling used in some sort of way and have a very sort of sense of having been used in the past. And what people really need is relationships that allow the organic growth of things that will be mutually beneficial. And it's very hard to come up with something that's mutually beneficial if you don't know the community that you're connected to.
Thank you very much, all of you. This is Robin Landsey, and I appreciate all of our panelists and wonderful, rich discussion that we've had, and many, many, many thanks to Aquarius for hosting as our moderator. And there has been a wonderful chat going on in the Q&A box here, and I appreciate all of the insights that have been shared and how to really advance this work and partner together. A resounding theme that we're hearing is truly partnering together, and that we can do this work. And it has been done in beautiful examples that have been shared. And as many, there's thrilled to see that there are over 90 participants here today, which I think is just clearly indicating that there is the need for this, there is the interest for this, and that there is, we can do this, and that we must do this, and that we will continue to do this and continue to lock arms together and work together on this. And recognizing that we're at the top of the hour and respecting everyone's time, again, I would like to thank all of our panelists and just your commitment to this, and to Aquarius for moderating, and again to the Legacy Project for hosting this webinar. As we have a slide showing here, I would like to introduce and to share that, again, this was recorded, and we will upload this to at the UAB CFAR Behavioral and Community Sciences Core new YouTube channel, and we will have that posted there. We also have a new Instagram and Twitter, and so those will be available to you. And on the next slide, you can see that there are a number of research articles that have been published, and we have selected bibliography here and many more that we can share, but we want to also highlight that there is science, that there is research, that we are doing work in this area, and we want to definitely share that information and continue to build on that, and so that this will be shared as well. And as our final slide shows, that some of the key handles for ways to get in touch with us on our social media platforms, and please do reach out to us, and we will do our best to continue this effort and look forward to our next webinar, which will be on Tuesday, June 16th at the same time, 12 noon Eastern, and then the third one on July 21st on Tuesday at noon as well. And please be on the lookout for this to be posted on the Legacy Project and all of their channels, as well as at the UAB CFAR. You will receive a automated sort of survey at the end of this, so please do fill that out and share with us suggestions for future webinar series topics, and we look forward to it, and thank you again for all who participated.
Thank you all.